Hi, my name is Jimmy Lyons. If you're watching this video, then you've chosen to start or continue living an active lifestyle by undergoing a total joint replacement. I'm very excited for you that you've made this decision for yourself. There is work to be done to reach your goals. The purpose of this video is to help decrease your anxiety by understanding the process of your joint replacement more thoroughly in the comfort of your own home, while also managing your expectations of what the post-op recovery will entail. Getting your joint replaced means a lot more than just pain control. Living an active lifestyle has a rippling effect not only on your physical and mental health, but your overall wellness as well. Everything from diabetes to heart disease to depression are all managed better if someone is able to move and be active and interact with others in a much more meaningful way. It affects your relationship with other people if you feel better about yourself and are able to do activities that you enjoy. With this video, I'm hoping that you and your family can go over this information that comfort your own home and have a better understanding of what the overall total joint replacement process consists of by knowing what to expect before, during, and after your total joint replacement. It is a big commitment, and there is a large team of people making this go right for you, all the way from our staff here in the office to nurses at the hospital, other physicians. I do feel the better you're educated on the process and the more you understand, the less anxiety you'll have about it, and also the better experience this will be for you. So let's get started by looking at some x-rays and go over what arthritis looks like. Now I'd like to go over what your knee arthritis looks like on x-ray. This is a representation of what knee arthritis looks like. It's not specifically your knee, but it's a good representation of what most knee arthritis looks like. And it also allows me to go over what the things that we're looking at on x-ray to know that you have arthritis. This is the outside of the knee and this is the inside. This is the top of the leg and this is the bottom of the leg. You can see here on the outside of the knee that there's still a space between the two bones. That is filled with cartilage. As you lose cartilage, which is what arthritis is, the bones get closer and closer together on the x-ray. You can also see that there's a bone spur, a small bone spur on this side. A bone spur is your body's response to the arthritis as it tries to stiffen up the joint. It's hard for you to tell, but in this picture, the knee has slightly malaligned or changed its angle because it's closed down on this side. The knee has become what we call a little bit bow-legged, and oftentimes people will see that their leg does change position as their knee becomes more arthritic. Here we're looking at the knee from the side, and here you can see more of the bone spurs that are more obvious. Here you can see that there's bone spurs in the back here, all along in here, in the front, and underneath the kneecap. This is your kneecap. Again, this is the top of the leg and this is the bottom. Again, you cannot see any joint space through here. And again, we see all these bone spurs, which again are a sign of arthritis. Now I'd like to go over how we perform your total knee replacement. First, we'll start off with an incision over the front of the knee. This is your femur or your thigh bone, and this is your tibia or your shin bone. Once we make your incision, we can come into the knee. And you can see here they've represented your arthritis by just this red area on both sides. When we make the cuts to remove the arthritis, the cuts are made at a certain angle that's specific to the size and shape of your bone. This allows us to remove just a small layer of bone. Again, that's not very thick, but we're just removing away the arthritic surface. This leaves us with the femur cut at a certain angle, again, that is specific to your size and shape of your femur. Then we make the same cut, not very large, again, on the shin bone side, just removing the arthritic surface. We then take this metal implant that's made of cobalt chrome that matches these cuts that we've specifically made to your femur. And this gets placed on there and bonded to there with a medical grade cement. It's stable the second you leave the operating room. On the shin bone side or the tibia side, we do the same thing where we take a metal plate with a very small stem in it and attach a plastic piece. This gets bonded to your shin bone side. Now you can see that you now have artificial surfaces articulating against each other. And this resurfaces your arthritic joint and therefore taking away your pain and improving your stability and function. You can see here that we're still using your own ligaments on each side of the knee to stabilize the knee from side to side. And that's how we perform your total knee replacement. Now we're showing you an x-ray of what your knee will look like after you've had surgery. This is after you've had your total knee replacement. Again, the outside of the knee and the inside, and this is the bottom of the leg and the top of the leg. Here you can see the metal implants quite well in this x-ray, and they are bonded to the bone with this cement. You can see a little bit of a shadow of the cement right here. In between the joint, or between these two metal components, there's a plastic piece. That plastic piece is the polyethylene, and that doesn't show up on x-ray. So you're essentially articulating this metal against that plastic, and the plastic is secured to this metal tray. Now if we look at this from the side, you can see how the femur sits over top of the bone, almost like a cap. And again, you can see a little bit more of the cement that's used to bond the femur to the knee. Again, on this side, you can see a small stem or post that comes down, and you can see the clips that the plastic piece clips to. On the back of the kneecap here, you can also see a little white line. There also is a plastic piece resurfacing the back of your kneecap as well, but we do keep majority of your own kneecap. And here you can see you would have a tendon here and a tendon attaching the muscles through the front of your knee through your kneecap. So you keep your own kneecap, but we do resurface it. And then obviously you end up with this resurfaced femur and tibia, or thigh bone and shin bone. And it ends up with this metal cap articulating against the plastic. All right, now I want to talk to you about preoperatively. After you've been scheduled for surgery, there are a few things we need to do to get you safely ready for surgery. First, you will need clearance from your family physician to make sure you're fit for surgery. Preoperatively, we will also get some tests that may include some basic blood work, a urine sample, and a nasal swab to make sure you're not carrying any concerning bacteria that could cause a problem with infection after surgery. We do this to decrease any risk of infection or post-operative complication. The night before surgery, we ask you to shower with a special soap the night before and also the morning of surgery. We ask that you put clean linens on your bed. Again, this is all an attempt to minimize any risk of infection. Also, the night before surgery, you cannot eat or drink anything after midnight in preparation for surgery the next day. When you come to the hospital, you will meet several people that are part of our team. After you go to registration, you will be brought back to the preoperative area. Here we will meet our preoperative nursing staff that will help get you ready for surgery by placing an IV and give you some medications to help you relax. You will also meet the anesthesiologist who will go over their plan to keep you comfortable during surgery. Part of this typically involves a nerve block to help decrease your pain post-operatively and decrease the amount of narcotics that you may need after surgery. There will be more education on this during your hospital stay, but we do have an example of the pain block here. It's hooked up to this pain pump, which will be connected to a bag of medication that will go in a bag that you're able to carry. There will be more information on this to educate you more thoroughly on this during your hospital stay. All right, from there, we'll see you preoperatively. Okay, I know we don't want to talk about this, but there are risks to surgery. I think it's important that you're educated on them. The major risks of surgery include blood clots, excessive knee stiffness, knee instability or too loose feeling, and infection. Our process is set in place from beginning to end to minimize these risks, and if you have a complication, it's important for you to know that it could result in further hospitalizations or more surgery to correct the problem. Infections do not happen very often, but when they do, they can be very devastating and usually involve more surgery and more time in the hospital. Again, most of these things do not happen, but it's important for you, as someone signing up for surgery, to understand that these things are potential risks of surgery. All right, now to go over your post-operative recovery. After surgery, you will spend a short time in recovery, and then you'll go up to the hospital floor where you'll meet our team of nurses, therapists, and medical staff that will be helping you. Our goal is to get you up and moving the same day of surgery. Our goal is then at this point to make sure that your pain is in good control, you're able to walk safely with a walker. From here, most of you will spend one night in the hospital and be able to go home by noon the next day. If you're planning on being discharged to a rehab facility, then your stay in the hospital may be more than one night. The nurses prior to discharge will also educate you on the discharge instructions. You will go home with one of two different types of dressings on. Either a zip line, which almost looks like zip ties, that'll be over top of your incision, and this just stays on until you come back to the office, and you can shower with this on. The other one is a brown rubbery dressing that this stays on for 5 days after surgery. You can shower with this on. After 5 days, you just take it off, and then you're okay to shower and get your incision wet. All right, when it's time for you to go home, we want to make sure all your questions have been answered and you understand the recovery process is how it's going to work. You will take some medication for blood clot prevention for 4 weeks after surgery. Typically, this will be aspirin, 81 milligrams once in the morning and once at night if you're not already on any kind of blood thinner for blood clots. We also use compression socks that you will wear during the day and take off at night. People often ask what medications they will take for pain after surgery. You will be given a prescription for pain medications to go home with. In addition to this, I also encourage you to take an anti-inflammatory such as ibuprofen or naproxen, in addition to your pain medications. This helps decrease the amount of narcotic that you need, hopefully avoiding problems with constipation and other negative side effects of pain medications. Taking a stool softener is also a good idea while taking narcotics. I do encourage you to take only as much pain medication, narcotic medication as you think you really need. Another question people have is how much therapy will I need after my knee replacement? This is a little bit different for everybody, but for the most part, generally we'll need about 4 to 6 weeks of therapy. This is done at an outpatient therapy office, and you will go about 2 to 3 times a week. Again, just to reiterate, it is okay to take an ibuprofen. For example, you can take 800 milligrams of ibuprofen, which is 4 over-the-counter tablets, every 8 hours, in addition to your aspirin for blood clot and also your pain medication. As long as there's no reason from your other doctors that you can't take an anti-inflammatory, such as history of stomach ulcers or cardiac problems. Okay, we will go over all these things again with you in the hospital as well, but hopefully this helps you hear it first here. Now to talk about your recovery and what to expect from your total knee. First, everybody does heal differently. These are general timelines and most people fall within this description, but certainly some may take longer or shorter to recover. Your first post-operative appointment will be at 10 to 14 days after your surgery. Here we will make sure your incision is healing okay and answer any further questions you have. We will also get an x-ray in the office to make sure your knee looks okay. Then we will see you back at 6 weeks after surgery. At 6 weeks, most people have typically made a lot of improvements with both pain decreasing and range of motion improving. Most people are without walking with a cane or a walker. If you have an office job, a lot of people may be back to work at this point. If you are a laborer on your feet all day at work, you may be off for up to even 3 months. It is very important to understand that your total knee replacement will get better for an entire year. Even at 3 months out from surgery, the knee still may be a bit warm to touch. It still may ache a little bit after a long day on your feet or be stiff in the morning. Patients usually say the last thing that goes away is aching at nighttime. It's the scar tissue around the knee that gradually becomes less inflamed over this year. As the scar tissue continues to remodel and become less reactive over time, your range of motion in the knee will also continue to make improvements as you get further out from surgery. This process will continue for at least a year out from surgery. Some people will have better range of motion than others depending on how your body heals, but our goal is to get everybody to a functional range of motion for your daily living activities. With a total knee, you can participate in all low-impact activities such as hiking, biking, swimming, golf, bowling, and recreational tennis, just to name a few. You can also ski or work out with an elliptical or other low-impact exercises. The main limitation is we just don't want any high-impact activities such as repetitive jogging or jumping. The implants really are not made for this sort of thing, and it could cause them to wear out earlier. People also want to know about kneeling on their knee replacement. What I tell patients is that they are not going to love kneeling on their knee replacement. For example, if you're on your knees a lot at work, it's okay to kneel occasionally at home. For church or for something like gardening, placing a pad on your knee will also make it more comfortable for you. It's also important to know that while we are replacing your knee to get rid of pain and give you better function, it should not be compared to a normal knee. Some people notice an audible sound at times going up and down steps or with certain movements. This can be very normal and it isn't a problem unless there is pain associated with it. We expect overall that the knee replacement should last for about 20 years. If you are younger and getting your knee replaced, it certainly could need a revision or another surgery at some point in time. Okay, lastly, if you do have any concerns after surgery, I encourage you to call our office or the on-call doctor prior to going direct to the emergency room. There's always someone available to take a phone call 24 hours a day. A lot of times we can troubleshoot your concerns over the phone, answer questions, or even help guide you in the decision-making process of whether or not you need to go to the emergency room or not. Emergency rooms can be very expensive for you and very time-consuming with long waits, and can place you in close proximity to other people with infections, which we don't want. We want to try and avoid this for you if we can. Certainly, during business hours, our office is always happy to see you and our nurses are available for questions over the phone. I hope this video has been helpful for you. Feel free to go over this information as much as you would like. If you have any other questions, make sure you reach out to our staff or myself and get these answered. I really want you to have a great experience with your surgery and to make this as least stressful as possible for you. Our staff is here to help you and take you through this each step of the way. I look forward to seeing you in your day of surgery.